Did you know that more than 1 billion people worldwide suffer from vitamin D deficiency? The shocking part, many don't even realize it. From unexplained fatigue to mysterious muscle pains, these symptoms could be hiding in plain sight. Stay tuned, because today, we're uncovering 11 surprising signs that you may be lacking this vital nutrient, and why it matters more than ever. But before we dive in, make sure to hit that subscribe button so you never miss life-changing health tips like this. Let's dive into the top 11 shocking symptoms of vitamin D deficiency that you must know. Have you ever woken up after what seemed like a full night's sleep, only to feel like you haven't slept at all? You're not alone. Chronic fatigue is one of the most common, yet often overlooked symptoms of vitamin D deficiency. This essential nutrient plays a critical role in maintaining our energy levels, and when it's lacking, it can leave you feeling sluggish and drained, even after hours of rest. Here's how it works. Vitamin D is involved in various processes in your body, including the production of energy at the cellular level. Your cells rely on mitochondria, the so-called power plants of your body, to generate energy. When vitamin D levels are low, the efficiency of these mitochondria decreases, leading to reduced energy production. The result? That never-ending exhaustion that makes it hard to get through the day. But it's not just physical tiredness. Low vitamin D can also take a toll on your mental energy. You might find it harder to concentrate, stay motivated, or complete tasks that were once easy. It's no wonder many people with a deficiency often describe feeling like they're running on empty. Unfortunately, fatigue caused by low vitamin D is easy to misdiagnose. Many attribute it to stress, lack of sleep, or simply being overworked. However, if you've been feeling unusually tired for weeks or months, it might be time to take a closer look at your vitamin D levels. What's even more surprising is that fatigue caused by vitamin D deficiency can affect people of all ages. Studies have shown that even young, otherwise healthy individuals can experience significant energy dips if their vitamin D levels are insufficient. For older adults, the impact can be even more pronounced, as fatigue can contribute to reduced mobility and overall quality of life. So, how can you combat this? The first step is awareness. If you suspect that your low energy levels might be linked to vitamin D, consider speaking with your doctor about a blood test to measure your levels. The good news is that fatigue caused by a vitamin D deficiency is reversible. With proper supplementation and lifestyle adjustments, you can restore your energy levels and feel like yourself again. Start by incorporating vitamin D-rich foods into your diet, such as fatty fish like salmon and mackerel, egg yolks, and fortified dairy products. Sunlight exposure is another natural way to boost your vitamin D levels. Spending just 10 to 30 minutes in the sun a few times a week can significantly improve your levels. But remember, depending on where you live and the season, sunlight alone might not be enough, especially for people with darker skin tones who require more sun exposure to produce adequate vitamin D. Finally, don't underestimate the power of supplements. A high-quality vitamin D3 supplement taken as directed by your healthcare provider can help you bridge the gap and reclaim your energy. And if you're feeling drained right now, take heart. Addressing your vitamin D deficiency could be the key to feeling energized and motivated again. Do you find yourself constantly battling colds, the flu, or other infections? It might not just be bad luck or a weak immune system. The real culprit could be a lack of vitamin D. This powerful nutrient is one of the most important defenders of your body's immune system. Without it, your body struggles to fight off even the most common illnesses. Vitamin D plays a critical role in activating and regulating your immune cells, particularly T cells and macrophages, which are like the soldiers of your immune system. These cells help your body identify and destroy harmful invaders like bacteria and viruses. When your vitamin D levels are low, these soldiers don't function as effectively, leaving your body vulnerable to frequent infections. Studies have shown that people with low vitamin D levels are more likely to experience respiratory infections like colds and bronchitis, as well as slower recovery times from illnesses. This is particularly concerning during flu season, or in the wake of global health crises, where a strong immune system is crucial. So, how can you reduce your risk of frequent illnesses? Start by boosting your vitamin D intake through sunlight, diet, and supplements. Spend time outdoors when the sun is shining. Consume vitamin D-rich foods like fatty fish, fortified cereals, and dairy products. Or consider taking a vitamin D supplement, especially during the winter months when sunlight exposure is limited. Remember, a strong immune system is your body's first line of defense. If you're constantly sick, it's your body's way of signaling that something is off. Don't ignore it. Check your vitamin D levels and take action to protect your health. Are you experiencing persistent bone pain, especially in your lower back or joints? It might not just be a sign of aging or overexertion. A lack of vitamin D could be silently weakening your bones and causing this discomfort. Vitamin D is essential for maintaining bone health because it helps your body absorb calcium, a critical building block for strong, healthy bones. When your vitamin D levels are low, your body struggles to absorb enough calcium from your diet. As a result, your bones can become brittle, weak, and more prone to pain and fractures over time. This condition, known as osteomalacia in adults, leads to softened bones and often manifests as deep aching pain, particularly in weight-bearing areas like your lower back, hips, and legs. The scary part? Many people dismiss this pain as normal wear and tear, delaying intervention until more severe issues, such as osteoporosis, arise. Osteoporosis significantly increases the risk of fractures, especially in older adults, and can lead to a decline in mobility and overall quality of life. If you're dealing with unexplained bone pain or stiffness, it's worth considering a vitamin D deficiency as a potential cause. A simple blood test can determine your levels, and addressing the deficiency early can prevent long-term damage. To strengthen your bones, make sure you're getting enough vitamin D. Spend time in the sun. Incorporate vitamin D-rich foods like salmon, tuna, and fortified milk into your diet, or consider taking a supplement recommended by your doctor. Combined with regular exercise and adequate calcium intake, you can support healthier, pain-free bones. Have you noticed more hair in your brush or shower drain lately? While hair loss can be caused by many factors, stress, genetics, or hormonal changes, unexplained thinning could be a sign of vitamin D deficiency. This crucial nutrient doesn't just strengthen your bones, it also plays a vital role in hair growth and follicle health. Vitamin D stimulates hair follicles to grow, and when levels are low, the growth cycle can be disrupted. Over time, this can lead to thinning hair, or even more severe conditions like alopecia areata, an autoimmune disease linked to vitamin D deficiency that causes patches of hair to fall out. Research has shown that people with alopecia or other chronic hair loss conditions often have lower levels of vitamin D compared to those without these issues. What's more, a deficiency can make hair loss worse when combined with other factors, like stress or poor diet. If your hair is thinning unexpectedly, it might be time to evaluate your vitamin D levels. A blood test can confirm if your body is getting enough of this nutrient. Fortunately, addressing the deficiency could help restore healthy hair growth over time. Start by getting more sunlight, which helps your body produce vitamin D naturally. Pair that with vitamin D-rich foods like fatty fish, mushrooms, and fortified cereals. If needed, a high-quality vitamin D supplement can also boost your levels. Remember, consistent care is key, not just for your hair but for your overall health. Have you been feeling unusually down, anxious, or moody lately? It might surprise you to learn that your emotions could be tied to your vitamin D levels. Research shows a strong link between vitamin D deficiency and depression, making this essential nutrient as important for your mental health as it is for your physical well-being. Vitamin D plays a critical role in regulating mood by influencing the production of serotonin, often called the feel-good hormone. When vitamin D levels are low, your body produces less serotonin, which can leave you feeling persistently sad, unmotivated, or even irritable. Studies have found that people with low vitamin D are more likely to experience depression, particularly seasonal affective disorder, SAD, which occurs during months with limited sunlight. Mood swings are another common symptom of vitamin D deficiency. You may notice sudden emotional shifts, feeling fine one moment and overwhelmed the next. This imbalance can affect your relationships, productivity, and overall quality of life. The good news is that boosting your vitamin D levels may help improve your mood. Spending time in sunlight, which helps your body produce vitamin D naturally, is a great place to start. Combine that with a diet rich in vitamin D sources like salmon, egg yolks, and fortified foods. If your levels are severely low, a vitamin D supplement prescribed by your doctor could make a significant difference. If you've been struggling with unexplained sadness or irritability, don't ignore it. Checking your vitamin D levels and taking steps to improve them might be the key to finding emotional balance again. Have you noticed that tasks you once found easy, like climbing stairs or carrying groceries, are now a struggle? This could be more than just fatigue or aging. Muscle weakness is a common, yet often overlooked symptom of vitamin D deficiency. Without adequate vitamin D, your muscles don't get the support they need to stay strong and functional. Vitamin D is essential for muscle health because it helps regulate calcium absorption, a mineral critical for muscle contraction and strength. When your vitamin D levels are low, your muscles may feel weak, tired, or even sore, making daily activities more challenging. Studies have shown that individuals with a vitamin D deficiency often experience reduced muscle mass and strength, which can lead to poor balance and an increased risk of falls. This issue isn't limited to older adults. Even younger people can experience muscle weakness if they're not getting enough vitamin D. Athletes with low levels may find it harder to perform at their best, while others may struggle with physical tasks they used to handle with ease. The good news? You can regain muscle strength by addressing the root cause. Spend more time in the sun to help your body produce vitamin D naturally. Pair this with vitamin D-rich foods like fatty fish, egg yolks, and fortified products. If necessary, consider supplements, especially if you live in an area with limited sunlight or during the winter months. If you're experiencing muscle weakness, don't shrug it off. Strengthening your muscles starts with ensuring they have the nutrients they need, beginning with vitamin D. Have you noticed that even small cuts, scrapes, or bruises take an unusually long time to heal? This could be more than just your body taking its time. It might be a sign of vitamin D deficiency. Vitamin D plays a critical role in your body's ability to repair and regenerate tissue, so when levels are low, the healing process can slow down significantly. Here's how it works. Vitamin D helps regulate inflammation and promotes the production of compounds like antimicrobial peptides, which are essential for fighting infections and speeding up recovery. When your body lacks sufficient vitamin D, wounds can remain inflamed longer, and your skin and tissues may struggle to regenerate effectively. This issue isn't just cosmetic. Slow wound healing can increase the risk of infections, especially in deep cuts or after surgery. It may also indicate underlying health issues, such as compromised immune function, which is closely tied to vitamin D levels. Studies have shown that individuals with chronic wounds, such as diabetic ulcers, often have lower vitamin D levels than those without such issues. By addressing this deficiency, they often experience improved healing outcomes. To support faster wound healing, make sure you're getting enough vitamin D. Spend time in the sun to help your body produce it naturally, and include vitamin D-rich foods in your diet, such as salmon, fortified milk, and mushrooms. If needed, consider supplements as recommended by your doctor. Don't let slow wound healing go unchecked. It's your body's way of signaling a deeper problem. Boosting your vitamin D levels can help your body recover faster and stay healthier overall. Do you find yourself sweating excessively, even when you're not exerting yourself? If your forehead often feels damp for no clear reason, it could be a subtle but significant sign of vitamin D deficiency. While most people associate vitamin D with bone health, it also plays a role in regulating body temperature. Excessive sweating, particularly on the forehead, is one of the earliest signs of low vitamin D levels. This happens because vitamin D influences neuromuscular function, and an imbalance can lead to overactive sweat glands. Many doctors even consider unexplained sweating, especially in newborns, one of the first indicators of vitamin D deficiency. Unlike other symptoms that may take years to develop, persistent sweating can show up early, making it a warning sign you shouldn't ignore. If you notice yourself sweating more than usual, especially in cool or normal temperatures, it might be worth checking your vitamin D levels. The good news? Correcting a deficiency is simple. Increase your exposure to natural sunlight, eat vitamin D-rich foods like fish, fortified dairy, and eggs, or take supplements if needed. Addressing this issue early can help restore balance to your body and prevent other deficiency-related problems. Tossing and turning at night, struggling to get deep, restful sleep? The culprit could be a vitamin D deficiency. While most people associate vitamin D with bone health, few realize its crucial role in regulating sleep patterns. Vitamin D directly influences the production of melatonin, the hormone responsible for controlling your sleep-wake cycle. When vitamin D levels are low, melatonin production can become imbalanced, making it harder to fall asleep and stay asleep. Studies have shown that people with vitamin D deficiency often experience insomnia, restless sleep, or frequent nighttime awakenings, leaving them exhausted the next day. But that's not all. Vitamin D also plays a role in reducing inflammation and stress hormones like cortisol, which, when elevated, can further disrupt sleep. This is why people with chronic vitamin D deficiency often report feeling tired during the day but wired at night, a frustrating cycle that impacts mood, focus, and overall health. So what can you do? Start by getting more sunlight during the day, which naturally supports melatonin regulation. Also, include vitamin D-rich foods in your diet like salmon, egg yolks, and fortified dairy products. If you suspect a deficiency, a simple blood test can confirm it, and a supplement may help restore balance. Better sleep starts with better nutrition. If you're struggling with restless nights, it might be time to check your vitamin D levels. Do your joints feel stiff, achy, or even swollen? If you're experiencing persistent joint pain, it might not just be due to aging or physical strain. Low vitamin D levels could be contributing to the discomfort. Vitamin D is essential for reducing inflammation in the body. When your levels are low, your immune system can become overactive, triggering unnecessary inflammation in your joints. This can lead to chronic pain, stiffness, and even swelling, making everyday movements feel more difficult. Studies have linked vitamin D deficiency to conditions like rheumatoid arthritis, an autoimmune disease that causes painful joint inflammation. But here's the tricky part. Joint pain from vitamin D deficiency often mimics other conditions. So many people ignore it or misdiagnose it. If you've noticed your pain worsening, particularly in the knees, wrists, or fingers, it might be time to check your vitamin D levels. The good news? You can fight back by boosting your vitamin D intake. Spend more time in natural sunlight, eat vitamin D-rich foods like fatty fish, dairy, and fortified grains, and consider supplements if necessary. Don't let joint pain control your life. Addressing a vitamin D deficiency could be the key to relieving your discomfort and restoring mobility. Are you gaining weight despite eating healthy and staying active? If the numbers on the scale keep creeping up with no clear explanation, low vitamin D levels might be playing a hidden role. Vitamin D helps regulate metabolism and fat storage, meaning a deficiency can slow down your body's ability to burn calories efficiently. Research shows that people with low vitamin D often have higher levels of body fat, particularly around the belly. This happens because vitamin D plays a role in controlling insulin sensitivity and hunger hormones, and when levels are low, your body may store more fat instead of using it for energy. But it doesn't stop there. Vitamin D also affects mood and energy levels. If you feel tired or sluggish, you're less likely to be active, which further contributes to weight gain. Some studies even suggest that vitamin D deficiency may increase cravings, making it harder to stick to a healthy diet. So how can you fix this? Boost your vitamin D intake by spending time in natural sunlight, eating vitamin D-rich foods like salmon, egg yolks, and fortified dairy, or taking a supplement if necessary. Addressing a deficiency won't magically make the weight disappear, but it can help restore your metabolism, balance your hormones, and give you the energy to stay active. Now that you know these shocking symptoms of vitamin D deficiency, it's time to take action. Check your levels, consult your doctor, and add vitamin D-rich foods like salmon, egg yolks, and fortified cereals to your diet. If you found these insights valuable, hit that subscribe button and join our growing community for more weekly health tips. Let us know in the comments, did any of these symptoms surprise you? Thanks for watching and stay healthy.